welcome. It is Friday, May 1st. We are hosting our Friday knee replacement Q&A. So what does that mean? It means that Dr. Sinha, my husband Raj, and I, Diana Braun, are here. We are the ones who wrote Knee Replacement Secrets, and we do our best to go live on most Fridays for you to be able to ask questions you have about knee replacement, whether you're preparing, avoiding, or maybe you're in the middle of it right now. Maybe you are trying to recover and you cannot sleep. You cannot get comfortable. You are swelling. You thought, I had this 2 weeks ago. I thought I'd be like running a marathon by now. What's going wrong? So we're here to answer all of your questions. I had bilateral knee replacement myself 2.5 years ago. So I try to post a video every single day on Instagram and Facebook to help educate you on what you can expect, give you tips and tricks, and that's really why we show up here every week. So 9 days post-op, Mary Ann. All right, so I'm going to give you some things to recommend that you're doing. Right now, the first 2 weeks of your knee replacement, you're 9 days in, is you really should be focusing on it already sounds like you're doing a lot. She's walking around with no crutches. She's taking a few short walks outside. So icing and elevating are really, really important to you right now, and you really, really need to make sure that you are straightening your knee as much as possible. You want to get it to that 0 degree, like you should be able to flatten it completely out, no bend. That's really important for you to do. If you get to that, then you're going to be able to get to all the bend that you need. I'm glad you're doing so well. So when you see that therapist in another week, really focus on making sure that leg is straight, and don't be overly concerned about your bend. I want you gradually working on it, and be careful. You sounds like you're kind of like me, Mary Ann. You're a go-getter, but we don't want you to overdo it at this point. I know that you want to get out there and do, if you're doing a little walk, just do a little bit more each day. Not like, I'll do double the amount of walking I did. This is the number one thing people goof up with early in recovery. We start feeling better, so we immediately go, well, I walked for 10 minutes yesterday. I'm going to walk for 20 the next day. Way too much. Way, way, way too much.
Emphasize control swelling. I tell people for the first week or two to basically limit their walking to about 100 feet twice a day. Obviously, things you need to do around the house, going to the bathroom, going to the kitchen, all that sort of stuff is just normal walking. I don't include that in the 100 feet a day, but if you're going to go for walks, you want to limit it to around that point, because you don't want to increase the swelling. That's where the pain occurs, and then the physical therapy becomes difficult.
Yeah. So, Mary Ann, you're smart to not overdo it. I love that you are conscientious of that, and I love that you're coming in from Norway. I hope that was helpful. So thanks for joining us today. It's awesome. Great question. All right, everybody, have a great weekend. We're glad you came.
Have a great weekend, everybody.
All right, bye.